Welcome to our sixth explainer on NHCX. Today, we're talking about a tipping point for India's healthcare. For years, there's been a hidden crisis of delays and financial stress. Now, a new digital highway is here to change all that. Let's explore why the National Health Claim Exchange matters right now.
This quote really captures the reality on the ground. Think about a small hospital owner. Treating a patient should be the end of the story, right? But for them, it's just the start of a long wait. It means endless paperwork and constant follow-ups. And they're always wondering when they will get paid.
And that wait is between 60 to 90 days. Imagine that. That's 2 to 3 months of uncertainty. This is how long hospitals have to wait for their payments. For a small provider, this delay is crippling. It is a real threat to their existence.
So, what caused this problem? For years, our health insurance system has been defined by chaos. It was fragmented and incredibly inefficient. Let's take a look at what that chaos really meant.
The root of the problem was quite simple. There was no standard way of doing things. Every single insurer had their own forms and their own portals. This created total confusion. It led to unpredictable payments and very high costs. Over time, it just eroded trust in the system. The numbers really show the scale of this problem. A single hospital had to manage 15 to 20 different portals, and on top of that, up to 30% of claims were rejected at first. This meant starting the whole process over again. It was a huge drain on time and money. So, how do we fix this chaos? The answer is the National Health Claim Exchange, or NHCX. The best way to think about it is as a new digital highway. It is here to replace all those old, confusing back roads.
Now, NHCX is not just another piece of software. It's a foundational piece of our national digital infrastructure. It is a single, secure network. It connects all hospitals and payers through one gateway.
To be very clear about its role, NHCX is a secure gateway. It's like a post office. It takes a sealed package from the hospital, it delivers it to the right insurer, then it brings the response back. It never opens the package or keeps a copy, it simply routes information. So how does this digital highway actually work? It's a very simple flow. First, the hospital sends an encrypted claim to the NHCX gateway. The gateway then securely routes it to the correct insurer. The insurer processes the claim and sends a response back. Finally, the gateway routes that response back to the hospital. What makes all of this possible? It's a common language. This language is a global standard called FHIR. It ensures all the data is structured in the same way. This means computers can read and process it easily. And that is the key to unlocking automation. Okay, so that is the how. But what does it actually change for everyone? This new digital highway is a big deal. It's a fundamental shift, creating a new era of efficiency. Let's see how it impacts each stakeholder. Let's start with hospitals. The impact here is huge. That settlement cycle of 60 to 90 days, that's projected to become just 7 to 15 days. And administrative costs are expected to drop dramatically. This means hospitals can focus more on patient care. So for hospitals, the single biggest benefit is one word: predictability. A standard process means they finally get cash flow stability, and that is a complete game changer. Now, what about the insurers? They see massive gains in efficiency too. Today, less than 5% of claims are processed automatically. With NHCX, that could go up to 80%. Processing time could drop from days to under 24 hours. The core benefit for insurers is automation, but it is also about intelligence. With standardized data, they can use new tools. This helps them detect fraud much more effectively. And finally, what does this mean for patients? The experience gets much smoother. Pre-authorization could take just hours, not days, and the success rate for cashless claims is expected to rise. This brings real peace of mind. So for patients, the main benefit is a faster, smoother, cashless experience. It means less anxiety during a stressful time and a much greater focus on recovery. So as you can see, NHCX is more than just an operational fix. It's a key part of India's larger digital health journey. This is why this moment is a true inflection point for the country. You see, NHCX is a foundational layer of a bigger plan. That plan is the Ayushman Bharat Digital Mission, or ABDM. NHCX provides the rails for ABDM's national vision. It is the critical infrastructure that makes everything else possible. And this is not just a plan for the future. It is happening right now. Already, 34 insurers and TPAs are live on the network. Over 300 hospitals are in the process of integrating. The momentum is clearly building. By creating the rules of the road for data, NHCX does something crucial. It enables future innovation. Think of new fintech solutions or advanced analytics. This highway makes it possible to build them.
So what is the road ahead? This is really a long-term transformation. The journey is only just beginning. The platform is now in place. The protocols are all set. Success from here depends on ecosystem adoption. It is up to everyone to connect to this new network.
So, the National Digital Highway for Health Claims is here. The real question for all of us is this: what will we choose to build on it?